Okay, so now we have this foot. And we certainly can talk about the nails, but there's some other stuff going on there. And you've had, this is the bunion, this is a hammer toe that's dislocated up over the top. Now, it's looked like this for about how long?
10 years
Okay.
with the hammer toe.
All right, and is it painful when you walk?
It's painful when you just moved it there.
Just moved it?
Yeah.
Okay, sorry.
Yes, it's painful in shoes.
Mm-hmm. Is it painful in shoes because it rubs on the top? Or is it painful in shoes because it hurts underneath, or?
Both.
Okay.
Yep.
And have you had other podiatrists or other doctors take a look at it and make a recommendation?
And the only thing they said is they can do custom orthotics.
Which at this point is not gonna get rid of the bunion or
it's
bring the
not-
toe down?
No, right. Right, doesn't affect the toe.
Okay.
Yeah, I've been wearing custom orthotics for 40 years.
Mm-hmm. Which may have actually slowed this way down.
Yes, we don't know. There's
Right, okay. So when you have a foot with a bunion like this, you okay if I draw on your foot?
Yeah.
Okay. So,
By the way, it's not just that toe that bothers me underneath.
It's directly
It's
under.
this one
okay.
also,
On the tip or underneath?
underneath,
Okay.
in the metatarsal.
So this is your first metatarsal bone right there.
Mhm.
And then this is the first bone in your toe,
Yep.
let's say. Now, there's two muscles that attach to the base here. One goes down the foot this way,
Mhm.
and one goes obliquely across the foot this way.
Mhm.
Now, in a perfect world, when you're about to toe off, when you're walking, these two muscles pull at the same time, make this into a rigid lever so that then you can toe off. What happens with a bunion is this one starts to overpower that one, and it starts to pull that toe over. And then as that toe goes over, it buckles the head of this metatarsal out that
Yes.
way. And that's what gives you the bump. And then as this toe starts to move over, it creeps under that hammer toe,
Yep.
and the hammer toe starts to lift up. And now this is dislocated on top of that second metatarsal,
Yep.
and it's pushing it down into the ground, which is why it hurts
Yes,
on the bottom here.
yes.
Okay. So the choices for treating this non-surgically are things like a splint to hold that down
Mhm.
and a spacer to hold that over.
Mhm.
The custom orthotics can take the pressure off the bottom here
Mhm.
so that it doesn't hurt so much to walk.
Mhm. I have substantial metatarsal pads in my custom orthotics.
Okay, that sit underneath here.
Yep.
And lift that up a little bit while you're walking.
Yep.
But that still doesn't take this down off the top of that bone and bring it down.
Right.
Okay. So we can take some x-rays, and then we'll talk about if we were to fix this, what would it entail?
Mhm.
Okay? You game?
Yep.
Okay. Okay, so if we were to do surgery on this, given how severe this bunion is, it would require that, because this is now out like this,
Mhm.
it would require that we come back here, probably the most common type of procedure, and take a wedge of bone out and move this over, and then put a couple of screws through it
Mhm.
to hold it there. Then, most likely, having to come and take a little wedge also out of here to close it down that way. Now, because of the way this cut works, you couldn't walk on that for at least 4 weeks after the surgery. And then with this, we would have to take out some of the bone and probably fuse this toe straight. And with some kind of device inside there to hold it straight. But look at how tight these tendons are.
Yeah, right.
So that would have to be lengthened during surgery. So to fix this bunion surgically, with the more common types of procedures, you would be non-weight bearing for 4 weeks on one of those knee scooters or crutches, and then in a walking cast for another 4 weeks. Pain, not horrible, but it's really inconvenient, especially because this is your driving foot.
Yeah,
And so for that entire time, you could not drive.
yeah.
So when you're standing, that right foot looks pretty uncomfortable and pretty painful.
Yes,
But you've been working on something, or we've been working together, I guess, on a device that will help straighten it out a little bit
Yes.
while you're wearing it. It's not going to fix it, right?
right.
Okay. So go ahead and put it on, and then we'll come back. So this device is called what?
It's called InAlign.
Okay.
That's the brand name for it.
Okay. And it's not on the market yet.
Nope.
But if anybody is interested, you can learn more about it and help us get it to the market
Yes.
and I'll put the website down on the bottom. But if you look at that, it's bringing the big toe over somewhat, and it's definitely holding that second toe down.
Mhm.
And that makes wearing shoes way more comfortable. huh?
Yes. It also moves the third toe back to the right because that tends to stick under the space where the second toe is.
Okay. So that looks a whole lot better than it did.